Dr. Matthew Iasiello. I'm a researcher at the SAHMRI WELLCO. SAHMRI stands for the South Australian Health and Medical Research Institute, and also at the University of Adelaide. My educational journey and career, I've had a few career turning points along the way, some twists and turns, but I started in biomedical research. I took a few years off in sort of private industry before returning back to research, where I completed my honours in breast cancer research, and then sort of took another turn again into mental health research. So again, I started off in a lab before finding this new team that was starting in the institute that I was working, which was about the promotion of mental well-being, and that's been something now that I've been working on for the past 10 years or more. My research is focused on the promotion of mental well-being. So that looks like a few different things. The first is understanding the most effective ways to promote mental well-being. So what are the skills that people can practice, the tangible things that they can be building into their lives to promote their own sense of mental well-being. And there are a couple of applications of that. So then turning that into training programs that are evidence-based and evaluated, trying to understand what resonates for people and what makes a difference. The other side of that is a little bit more theoretical, which is what do we actually mean by well-being? So I think we have this really interesting advantage because we're quite translational researchers. We work at the coalface, we work with thousands of people a year, and they introduce interesting research questions that researchers have actually probably don't have very good answers for. And as a result, this idea of what do you actually mean by mental well-being has been one of them that's led us on a series of studies now with an international group of collaborators trying to get to the bottom of that. I'm passionate about the work that I do because we just see such a glaring gap. At the moment, our mental health care services are predominantly focused on treating mental illness, and there's really not much out there around prevention and promotion. So I think when we talk prevention, we're talking about sort of reducing risk factors, and there's some work going on there, but it's the promotion of what it looks like to feel well. That's where we think there's a tremendous gap and lots of obvious solutions that are just requiring more of an evidence base, I guess, to advocate for this and closing that gap. Outside of the work environment, I've got 2 little kids at home with my wife, so I basically drop everything when I come home and just spend as much quality time with them as I can. And so that's as much for them as it is for me, and just it's such a blessing basically to be able to come home. Doesn't matter what kind of day you've had, they're always happy to see me, and so that's what I fill all my weeknights with and weekends with.